So basically what happened in the acute, that the tooth is come out from the socket, and basically one most important thing in pulpitis, it is the so basically in pulpitis the so basically in pulpitis, as we say, that the cold and the hold cause the stimulation of the pain, but in periapical periodontitis it does not happen it basically. Okay, in radiograph, the as we say, in periodontitis the bone resorption occur, but in acute it has insufficient time to cause the bone resorption. Number one, this thing. Number second, you will see that the widening of the pedial fibers in the previous slide, which I have also circled, that the pedial fibers are slightly wide basically, and the lamina dura is not then defined. Okay, the inflammation may be in transit. The inflammation cause transition, that is to acute, to by acute trauma rather than by infectious. Okay, then coming towards the chronic periapical periodontitis, which is very important. Most important, there is no painful, as we have studied that there is acute inflammatory exudate in the pedial region, in the apex, the pedial fibers, but there is no pain, there is no painful condition in which the periapical portion of the tooth is chronically inflamed, means there is a inflammation. Okay, because there is a granuloma, there is a chronic inflammation, and there is a granuloma formation. Basically you have a persistent irritation, means that there is a constant irritation caused to the tooth in the form of bacteria or either the toxins that is produced by the bacteria in the pulp region, or in the root canals, that leads to the chronic periapical periodontitis. Okay, the as you compare with the acute, it was a rapid onset, it is a very gradual onset. There is little or no discomfort, but there was a discomfort because there was a pain basically. It has an intermediated discharge of pus, but there was a pus formation. There was slight redness on palpitation, but there was even on the slight touch on the pulp, the pain was elicit. The tooth is non-vital, it means that the pulp is damaged, dead. As we consider percussion, it means that produces, very important, produces a dull sound. Okay, now how you characterize this? So basically there is a bone resorption because it is a slow process, and there it has sufficient time for the bone resorption. So you have the periapical bone is now replaced by the inflamed granulation tissue, which is basically a periapical granuloma. Okay, so very important. Second, basically meaning of this point means that there is a very, as you consider here, this is the pulp, and here is basically the granulation tissue. The granulation tissue is then surrounded by the collagen fibers. These collagen fibers basically separate this granuloma from the alveolar bone. Yes, from the surrounding bone, now it is separated. This collagen fibers form like a capsule. Either it will be either attached to the root surface, or either it will be removed from the tooth. Okay, from the tooth surface. Moving towards its histology, as we saw, there is a capsule, outer capsule, and the outer capsule is formed by the collagen fibers or a dense fibrous tissue. Okay, then you have the central zone of granulation tissue, as we have said. And in granulation tissue, it is the inflammatory cells. So you have lymphocyte, plasma cells, and macrophages. Very important. Basically it has, you have also T cells and plasma cells, and even some foamy macrophages. Okay, you have also T lymphocytes in them. The deposits of cholesterol and hemosiderin are also, means there is a cholesterol collapse, and hemosiderin is also present in the granuloma. Okay, why these cholesterol collapse and hemosiderin? You remember that in the cyst, in radicular cyst, you have this in histology. So after the cyst formation, you have granuloma, you have this. So that's why. Then this is also surrounded by multinucleated giant cells. Of course, there is a chronic inflammation, so there will be these multinucleated giant cells. You can see this is the histology of that periapical granuloma. You can see here is formed this periapical granuloma. So you can see periapical granuloma. This is the microscopic appearance of the early stage of granuloma development, that is showing the granulation tissue at the apex foramen, surrounded as usual by a fibrous tissue and the outer zone of cortical bone. You can see here, there is this bone. this is the bone we have, this is the fibrous tissue basically, this is the granuloma we have, and this is the root apex. Now the radiographic feature is very important. So basically you can see a oval radiolucency, which is basically a demarcated outline the apex. There will be a blackish area. A granuloma basically is undergo acute exacerbation and have less distant line of demarcation between a bone and granulation tissue. So basically they are saying that the granuloma has a very poor demarcations or less distant lines of demarcation between the bone and granulation tissue. And of the demarcations, they are not well demarcated, we can say. Long study granuloma, acha, when the granuloma is present for a very long time, so they displace the hypercementosis, means they then there is hypercementosis and the blunting of the root tooth.